In Malaysia, those over the age of 60 don't have to pay to see a doctor, while those under 60 only have to pay about 25 US cents to see a doctor at the public hospitals. Still, public hospitals are always overcrowded and the wait for surgery may take several weeks. Those who don't want to wait will go to a private hospital or private clinic to see a doctor. Yet these private hospitals are not subsidized and much more expensive. In more recent years, a number of Malaysian doctors who have trained in Taiwan have returned to their home country to practice, where previously many of these doctors simply prefer to stay in Taiwan to work. Let's take a look at the healthcare system in Malaysia.
In the late 19th century, ethnic Chinese moved southward, as Malaysia was a British colony which relied upon Chinese laborers.
At that time, the Lamwai Hospital was established here in Southeast Asia to treat our compatriots.
The Lamwai Hospital started 100 years ago by offering traditional Chinese medicine, and today it has evolved into largely a local hospital.
After more than 100 years, Penang's Lam Wai Hospital has also offered medical tourism services for those in neighboring Indonesia, who now account for 20% of visitors. Flights from Indonesia's third largest city of Medan to Penang take just 45 minutes.
Malaysia health tourism is very aggressive, moving forward towards telling the world that Malaysia healthcare tourism here is very affordable.
In fact, the number of specialist doctors in Malaysia is still lacking. We have too many residents, but not enough specialists.
According to the World Health Organization, there are 1.83 doctors for every 1,000 people in Taiwan, compared with 1.28 in Malaysia, meaning it lags behind that of Taiwan.
A few years ago, we began to go to Taiwan to bring back the doctors who went to Taiwan to study.
Living in Taipei before, you may complain to your friends, but when you leave, you may find that life in Taipei is really good.
Missing Taiwan is a common complaint, as over the past 6 years, many Malaysian Chinese physicians have returned from Taiwan.
As for the doctors is concerned, I think doctors here receive more respect from the patients than they do in Taiwan.
While Taiwan's health insurance system has been very good for patients, it has gradually turned into a service industry, causing many of these doctors to leave Taiwan.
In Taiwan, after doing surgeries all day, I have a stack of medical reports on my desk that I can't finish, including health insurance reports, and then meetings which I will be fined if I don't attend.
Although Malaysia's health insurance system is different from Taiwan, their welfare offerings are quite good, with doctor services available for less than 25 US cents.
Malaysia is a country rich in natural resources, such as oil and palm oil. The tax revenue from these industries has helped pay for medical benefits.
Those more than 60 years old don't need to pay to see a doctor, while those under 60 having just to pay 25 US cents.
While it is cheap to see a doctor at a public hospital, there may be a lot of patients, which lessens the quality of care. Surgery requires a very long wait, leading to lots of complaints.
If I go to a public hospital to do endovascular surgery and I'm unable to schedule a date, then I will simply leave and go to a private hospital for a surgery that may take place as early as the next day.
Private hospitals don't receive any government funding, as all of their money comes from patients.
Health insurance here is called a medical card, and if they buy extra medical insurance, if there is any illness, it will be covered.
The Malaysian government hopes the Iskandar region can follow Singapore's model, creating a so-called one-day living area. Some 1.4 million people lived in such an area in 2005, though in 2025 this number is expected to surge to 3 million. The number of those simply working in this area will also rise from 610,000 to 1.428 million. Singaporean medical groups are optimistic about the development of the Iskandar area, building specialist hospitals in these special economic zones.
马来西亚的私人医院。
Something different from Taiwan is that the doctors here rent clinics from these hospitals, and some of the nurses are directly engaged by these doctors. The Regency Specialist Hospital has a sort of mini Taiwan village where more than half of the doctors have studied in Taiwan. The center is quite popular, with many coming to see doctors that have trained in Taiwan.
Ethnic Chinese typically want to see specialists, and these Taiwan-educated doctors are very popular.
The first thing is that communication is convenient, and the second is that they are not too proud.
In fact, we were trained in Taiwan, and we have found that such medical students, when they go to hospital to serve as a physician, Taiwan's medical standards are quite high.
In this conference room, doctors who trained in Taiwan chat easily with Malaysian physicians. This particular doctor says that she even came to Taiwan to attend the medical courses and spoke openly about Taiwan.
We did a lot of laparoscopic surgery, but we still cannot match, the level of minimally invasive surgery in Taiwan.
Hospitals in Taiwan were actually very open in terms of sharing.
Regarding oncology, neurology, and cardiology, we have had lots of communication with these hospitals about this.
Hospitals have sent high-level delegations to visit Taiwan, including Chang'an Memorial Hospital and Hualien Ziji Hospital. They have been especially interested in the Lexel Gamma knife, which is quite common in hospitals across Taiwan, though Malaysia has only one unit.
Malaysia's adoption of the Lexel Gamma knife is much later than that of Taiwan, probably some 10 to 20 years.
Regency Specialist Hospital is located in Johor Bahru, which has seen the rapid development of more and more clinics. The Regency Specialist Hospital, for the first time, sent high-level executives to Taiwan to recruit Taiwan talent.
Coming to Taiwan campuses, Regency Specialist Hospital and other businesses have been actively recruiting staff.
We have previously concentrated our efforts in Singapore and Malaysia and have not yet begun to recruit talent from Taiwan. This time we're very lucky to get involved to Taiwan to recruit staff.
More medical groups coming to Taiwan, this is a positive affirmation of the talent and skill in Taiwan, as Malaysians are beginning to treasure this resource.